It's 20 minutes to the top of the hour, everybody. Measles now spiking in several parts of the country, and it's creating panic. And it's leaving some who are already vaccinated wondering, do I have to worry about this or am I good? Well, that depends on when you were vaccinated. NewsNation's Elizabeth Pran is following this one for us. So, Elizabeth, let's get this one straight here. Has the vaccine changed over the years?
Yeah, there's been a number of iterations, right? It's changed in potency, it's changed in how it's presented. So the MMR vaccine that I got in the early 80s looks similar really to what my kids got, but not to my older siblings or my parents. There was really a big shift in the 70s. So let me break it down for our viewers depending on when you were born, right? So if you were born before 1957, so let's say you're 68 years old, or maybe a little bit older, you're likely protected. Measles was rampant at that time. You could talk about antibodies being widespread, herd immunity. Now, if you were born between 1957 and 1962, so let's say you're younger 60s, it's a little bit fuzzy here. The vaccine rollout was just taking place and the disease was still circulating, so you might have antibodies. And the same guidance right around 1967. So at that time, the initial rollout of the vaccine, so between 1963 and 1967, it was an inactive version of the vaccine. So not as effective. But then again, you may have the antibodies. Now, if you're a 70s or an 80s baby, as I mentioned, we're pretty much protected, right? As I mentioned, the MMR debuted at the time. It's what kids are given today. Do you know if you have it? A simple antibody test would tell you that. Who is most at risk? Obviously, healthcare workers, someone who travels a lot, specifically internationally, and of course, people who are in a classroom setting. So kids, even college students. Markie?
Yeah, a lot of people consulting their doctors or pediatricians right now on this one. And Elizabeth, before we let you go, we are still seeing an uptick in these cases, right?
We're really seeing a wave. We're seeing one out of Texas. Health officials give updates on Tuesdays and Fridays, so we're waiting to see if the cases are rising there. Right about 300 that we know of across the nation, across 15 states. You might be wondering, why are we seeing the spread? Well, basically, there is still vaccine hesitancy. And keep in mind, if you are not vaccinated, you have a 20% chance of ending up in the hospital if you contract this very, very contagious disease. Look at some of these stats. Between 2023 and 2024, the number of vaccine exemption requests went up from 3 to about 3.3%, so an uptick across 40 states. And 14 states say they're seeing a 5% request for vaccine exemption. So important statistics, very significant. Measles, as I mentioned, is hugely contagious. It's hugely preventable. We had conquered it about 25 years ago. Doctors say you need herd immunity. You need that 95% vaccination rate in order to stave off the disease. As I mentioned, can stay active in a room for up to 2 hours, Markie. It's very contagious.
Yeah, that herd immunity important in keeping this at bay. Elizabeth Pran, thank you so much for breaking down the latest for us there. Thanks for watching, everybody. Go to joinnn.com to find NewsNation on your television provider. Also, don't forget to click that red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.